Welcome to today's EMS Leadership Q&A. I'm Lisa Gerizzi, and I'm here with Robbie McHugh. We are the co-founders of EMS Leadership Academy.
And for those of you that don't know, we help EMS leaders bring out the best in themselves and bring out the best in others.
Today's question is, how can we get healthcare providers to take care of their own health?
This is a really interesting question, Lisa, and I think it can be very nuanced here. If we look at some of the bodies of research out there, there is a big debate about pay equity and what is pay equity. Does it cause, do low wage earners usually correlate to poorer health? So I think there's an entire conversation out there. I'll just share my screen briefly related to some of the literature out there around the correlation between low wage earners and poorer health. And I think some of the evidence is certainly showing there is a link between higher rates of heart disease, stroke, other chronic conditions that's just compounded with low wage earners. And when we look at the broad spectrum of public safety, I think we all know there's a huge gap with between fire, police, and EMS, often seen as the three parts of public safety systems. And unfortunately, what we've seen in New York City, the pay inequities in New York, it becomes very apparent that certainly healthcare providers should not be operating without decent wages. And I'd say also thinking about, are your healthcare providers also having access to affordable health insurance? For too many years, I think healthcare providers are working with either very expensive health insurance or without any health insurance at all.
Absolutely. And I think the other aspect here is it sort of goes hand in hand with, people who feel valued, who feel cared for, tend to take better care of themselves. Just look at your own life, for those of us watching or participating in this conversation, is the times you took better care of yourself, you likely were in a different, or better state of mind. They kind of go hand in hand. And it's one of those, which came first? Am I feeling better because I'm taking care of myself, or did I need to feel better in order to take care of myself? But for sure, they go hand in hand. And when we're talking about health, we're talking about both physical and mental health, right? Because both of those, again, they can't be separated. So I think that everyone needs to take time for self-care, to be reflective. There's a great quote that I'm going to read here by Margaret Wheatley, who's written a number of books on leadership. Without reflection, we go blindly on our way, creating more unintended consequences and failing to achieve anything useful. And I think it's just so important to recognize that self-reflection is an important part of both mental and physical health.
Yeah, Lisa. And also Wendy Lund recently said in one of her articles, I think when we hear about self-care, we often think of, we're just going to take a bubble bath, or we're going to really just take time to do nothing. And I think Wendy really poses an interesting pushback and says self-care can be seen as actually doing the work of self-reflection, thinking about those moments that you had and how you reacted to them, or what are you doing for your own self-care that's not just pure relaxation.
Yeah, because again, self-care could be, making sure you're eating healthy, making sure you're thinking ahead about your, nutritional intake and when you're going to exercise versus, just saying, I don't have time, which of course, many people, that's a valid issue. But again, when you take time to plan and reflect, those kinds of things can get solved. I mean, people are really smart. And when we take a few minutes to allow ourselves to be creative about what would take care of us, then we are able to solve lots and lots of these things that look like conundrums or, unsolvable. But when we take the time, we really can solve them. So I think it's important too, to find other people who feel like you do, who want to be healthier, who want to, think about this differently. And then when you're surrounding yourself with people who are in a similar mindset, you can learn from each other and you can get creative together.
It also reminds me of the quote that farmers don't grow crops, they create an environment in which crops can grow. So how are we as leaders creating an environment where our providers are taking care of themselves and they're healthy? They're not working 60 to 80 hours in a week. I mean, if that's
Yeah.
the situation that they're facing, then can we take some responsibility to how are we going to solve that for them and not just expect them to, again, in order to make up these wage gaps or this pay inequity, for them to be working an extra 20 hours of overtime in a week.
Yeah. It's a really important point.
So I'd say in closing here, just a call to action is be an advocate for pay equity and benefits. And as Lisa said, make sure people feel appreciated and taken care of. That's so critical in any organization. And there's an article we put together as well on self-care at emsleadershipacademy.com/self-care. So in closing, thank you everyone for joining us in this session of our weekly Q&A. If you have a question to submit, you can send us an email here at support@emsleadershipacademy.com, or you can leave us a voicemail, 888-330-8288. Thanks for joining us.